Senator Whitehouse.
Thank you, Chairman, and welcome, Mr. Azar. I don't think there is much that you and I are going to accomplish today on the question of drug pricing, but I hope very much that in office you will take the side of the American people and not just the pharmaceutical industry, or worse yet, the investors who have raided the pharmaceutical industry with no pharmaceutical background with the sole mission to jack up prices on necessary pharmaceuticals and extract money with monopoly authority. We know how to deal with that ordinarily, and I hope you'll help us deal with that. I want to talk about a different situation, which I think is an opportunity for considerable bipartisan progress. And I want to start with two Rhode Island stories. You know what a Medicare ACO is, I assume.
I do,
we
yeah.
have two Medicare ACOs in Rhode Island. One is a very early one, Coastal Medical, which over 4 years has saved Medicare $28 million relative to its benchmark while maintaining a 99% quality score. That makes it one of the very best in the country. Its average per member per year expenditure is going down, while the satisfaction and health of its members are going up. Similarly, Integra Community Care Network, it's been in less long, but over 2 years, Integra has saved Medicare $12 million relative to its benchmark while achieving a 95% quality score. I say this not just to brag on Rhode Island providers, but because I think it's the answer to a much larger question that we face, which is, here's the graph of health expenditures more or less in my lifetime for the country, 27 billion to 3.2 trillion. It's a curve that is breaking the bank. We've got to figure out how to fix it. One of the ways that we can look at fixing it is to look at this OECD chart that I use all the time, which shows a lot of our competitor nations right here, and there's the USA as a big outlier. This maps life expectancy. This maps cost per capita. That puts us at the highest cost per capita for health insurance, for health care in the world, and gives us life expectancy comparable to the Czech Republic and Chile, well below other developed nations that compete with us. And we're actually beginning to see a little bit of, if you go to my third and final graph, we're actually beginning to see a little progress here. Let me explain what this is. This top line, the red line, is what CBO predicted for federal health care expenditure back here when it made the prediction in 2010. Then events moved forward post the Affordable Care Act, and we got to here, and sure enough, we were coming in below. So here in 2017, the baseline was rewritten by CBO, re-predicted. And the difference in this 10-year budget period between what CBO predicted in 2010 and what it predicted in 2017 amounts to $3.3 trillion in savings. So the case that I would make to you is that if we want to take on the healthcare cost problem, we've got to take it on through entities like these ACOs, because there is a sweet spot where we can bring that cost back from our outlier position in the United States while improving the quality of care. I've seen it happen in Rhode Island. The reason that the cost is going down for Coastal Medical's patients is because they get home visits when they're sick, because there's telemedicine that gets their testing results in, because a nurse will call them when they don't hear from them, because somebody does a house check to make sure that there aren't slippery rugs in the hallways that might cause a fall. Over and over again, it is better, humane engagement that reaches the patient where they are, that has this wonderful twin benefit of improving health and the patient experience while also bringing costs down. We're not seeing a less increase in the cost curve from Integra and from Coastal Medical. We are seeing cost per member going down. Promise me that you'll work with us on that. Promise me that you will not get ideological when it comes to solving this problem, and that you will work to solve it in a sensible, bipartisan, thoughtful way.
Senator, I would just say amen. You know, I
Just hearing those stories is exciting to me. It is, I think, one of the great legacies of Secretary Burwell's tenure was launching so many of the alternative payment models that we have out there, and I'd like to keep driving that forward. That was that third leg of my priorities if I am confirmed as Secretary. I think for those of us who care so deeply about improving quality, reducing cost in our healthcare system, improving integration, coordination, just thinking about ways we can deliver better for our patients and our beneficiaries, there's just so much opportunity for bipartisanship here because we share so much of the same goals on this. And what we have to is, and Medicare can play such a role. It's the only payer that sits there with enough concentration of lives to change the system.
Correct.
I think, United Healthcare, as big as it is, I don't think there's a market maybe that it has more than a couple % of patients and has to follow what Medicare does. So I would be so excited to work with you on
Well, I'm going to invite you
like
to
this.
come to Rhode Island and see these guys.
I would love to.
They are really doing their trick.
I would love to do
and
so.
I look forward to that visit. Thank you, Chairman.
Thank you, Senator Whitehouse.